Hi, everybody. And we see people are still popping on, so let's just take a minute to allow everybody to get here so everyone gets to hear it all from the horse's mouths at the same time. All right. Just about there. Looks like we're just about there. So why don't we go ahead and get started? We're up to 112 coming in. So this says to me that there's a great deal of interest in what we're going to talk about today. And let me start by saying thank you to everybody who's taken time from their busy schedules just to join us today as we kick off this part of ADAMHS funding. This is the cycle in which we take a look at what we need in the areas of treatment and supportive services. And everyone keep in mind that is this funding cycle, as differs from our prevention cycle, which is on a state fiscal year and therefore kicks off in February. One of the things that I should probably start by sharing my name, right? Because there are a few people here that I don't recognize on screen, though I see a lot of folks who've been with us for quite a while. So I'm Helen Jones Kelly. I am the Executive Director of ADAMHS, and you're going to hear mostly from our team today, but I like to kick off just to be able, first of all, just to connect eye to eye with folks, even on the screen, and to make sure that we are all speaking from the same hymnal. With respect to what is happening within our arena. And when I say ours, you all know me well enough to know, those of you who do know me, I'm talking about us as the global system of care in Montgomery County. While this is the ADAMHS funding cycle, this is our behavioral system coming together really to kind of meld our thinking around what we need to be doing for the course of the next year. And that's all important, always important for me to be able to say to you, because you all know I walk my talk. So for those of you who may not have joined us before for this process, we are, as some of you know, statutorily responsible for the mental health and addiction services for our community. And because these are our levy funds, these are those funds which derive from our taxpayers based upon their property taxes. So we take our fiduciary role very seriously with respect to those precious dollars. I think one of the things that is important to remind you of is our statutory responsibility in terms of being responsible for planning, for funding, and monitoring those public funds, and being sure that the priority population would be those individuals and families within Montgomery County. Our mission remains the same. In fact, our board had a work session recently where they reviewed the mission and the vision as they do on an annual basis. And I think I need to make sure that everyone is aware. Our mission is transforming, excuse me, I ought to be able to say that in my sleep, transforming innovative behavioral health leadership and partnerships to promote a healthy region. And that's our goal with our funding at all times. What we hope for as we're all on this journey together is that achievement of a vision which would allow for an inclusive world where optimal brain health equity ensures that no one suffers in silence. And I think we all can share that goal as we think about why we come back to this work on a daily basis. So as we're talking about this cycle, keep in mind that we have a level of collaborative funding for those dollars with which we are purchasing your services. And of course, it starts, as in this case, with our human services levy dollars. But we also get state dollars. All of these are taxpayer dollars, along with some federal funding that is passed through from the state of Ohio, and sometimes in the form of grants, other times in the form of pass-through dollars from our, and I apologize, I didn't have the slides up for everybody as we're going through this, pass-through dollars in the form of federal and other funded grants. Our reality is that our state funding has begun to pick up over the years, and I need to ask someone to catch up with me on that third slide. Our state funding has caught up over the years. Those of you who are somewhat seasoned in the system of funding across the state of Ohio know that there was a period in which our state funding was at minimal levels as compared to other dollars, but the state has really stepped up its funding as a result of the opportunities that we've had to, and that's the collective we, to talk about the needs, especially as part of our opioid epidemic and some of the other really, really strong issues that have come across all of our tables around the growing and pressing needs of the individuals in our community. And we look very, very strongly at how we can use the state dollars and in some cases, preserve some of those precious local dollars because we know that they're not continuing to grow in the same way that the state dollars are. And of course, we go after whatever federal grants we can and try to leverage those dollars as part of our primary sources of funding. But we have all these blended funding streams, which then allow us to be able to work with a very healthy budget for funding within the community to the tune of about $48.2 million. With that said, and I just want to kind of go through this for those of you who may not have been part of our process before, we have literally a charge, if you will, from the state of Ohio, from the Ohio Mental Health and Addiction Services Office to assure certain services within our community. That's part of our continuum of care that's set out under Chapter 340.03A1 in the Ohio Revised Code. Those are our marching orders for those programs and services that we must put back into the community as part of our own existence. And we do have a slide on that that will be part of the packet that goes out, but it's up there now so that you can see this as we talk about those services where we're spending a great deal of our prioritization of funding, but also keeping in mind, and I'm not going to read it to you because you all are in these seats because you can read as one of the eligibility criteria for being here. And I don't want to insult your intelligence with that. But certainly I would ask you to really pay attention to these services as those things that we must do. And it's really, I think, a testament to how the system has grown over the years, especially when we look at things like recovery supports and those areas that continue to expand as part of the state's focus for targeting certain services. This is a really critical time for us because we know that the needs of our community have significantly increased as a result of this pandemic. We know that everybody has something going on right now, and we can't meet the needs of everyone, but there are priorities within our funding alignments. And we're going to ask you to really pay attention to what we're sharing with you today. This is our one chance for all of us on our team here to be able to talk with you about where we have to place dollars this year. And in some cases, because we tend to be a very fortunate community, thanks to the leadership with our county commission, with our human services levy, which is unparalleled in other communities, along with our ability to be able to draw down additional dollars, as I mentioned earlier, with the state, with some of the federal funding, it allows us to have a little bit of flexibility. And while we're not looking for a lot of new kinds of initiatives right now, we don't want to lose those in this process. We want you to be able to bring some of those ideas forward. And if we can't fund them right now today, we want to have them in our listing of things that we need in the community. Again, you all are our partners. You're out there, you're on the ground, you're doing the work, and your voice is very important in this process. I'm going to flip over to Kimberly to pick up from here, and you all will have an opportunity for questions in the chat. We encourage you to use that, or at the very end, we'll be able to take some time to answer some questions, okay? Give me a thumbs up if I've been clear to this point. Thumbs up? Thumbs up. All right, y'all, thank you. Kimberly?
Thanks, Helen. Thanks, everybody, for joining us. And welcome to calendar year 2023 Bidders Conference. We are excited to have you here, and thank you for moving through the technical difficulties. And now we are going to move on. Oh, or not. There we go. Can you guys see the screen? Okay, so yes. Okay, awesome. So what we want to talk about today are the funding requirements and also the things that we're looking at in our community. So these are the requirements to receive funding when you do your application. A provider must have an OMAS licensure or one of the other accreditations that are listed here on this PowerPoint slide. If you do not meet at least one of these accreditation requirements, you will not be eligible for funding. One of the other things, let me go back a second, that I do want to mention is that if you are new to this process, please put your information in the chat. One of the things that we'll be doing at the end of this is we're going to compile a list of the new providers that were on this call that may potentially want to apply for funding, and we will send that to Ascend, and they will go ahead and go into our provider portal, and they will create an organizational program for you so that then you can go in. If you are someone that has already done this before, you don't need to worry about that. So I will reiterate this again at the end of this, but please, if you are new, I need you to put your program, your name, and your email in the chat. So that's something that we need in order to be able to move through this process at the end of the day. I'm going to pass this over to Doug, and he's going to share with us about our fiscal requirements.
Thank you, Kimberly. Good afternoon, everyone. I'm Doug Thompson. I'm the fiscal officer for the board. I just want to quickly go over the fiscal requirements. These requirements have to be met in order to move your application forward in the process. For the organization information, there's a tab in the portal for this. New for this year is the SAM number. It's also called the UEI number, Unique Entity Identifier. We will need that information in the system. As you are aware, and Helen covered that at the beginning, is we receive federal funds and we're required to track those SAM numbers. Again, that replaced the DUNS number. Just like last year in our previous applications, we will need a certificate of good standing from the Ohio Secretary of State. For those new organizations, there's the link. Again, this will be provided after this session as well. Financial insurance, and David will cover some of this as well. But for those existing providers of the ADAMHS board, we will need an updated certificate of coverage with ADAMHS as the holder of that certificate. Financial audits, as you know, in order to do business with the ADAMHS board, we require independent CPAs reviews of your financials. We'll also need a copy of your organizational budget, your direct and indirect costs, as well as key performance indicators. You will use your most recent financial audit to complete this in the portal. These are benchmarks that we look at for current assets, current liabilities, etc. There's also going to be a document provided after this session that will be titled Calendar Year 2023 Funding Priorities and Guidelines. This document will have additional financial definitions as it relates to what is direct cost versus indirect, unallowable, and program income. We use the OMB guidance as our source. Again, that will be listed in the document. Kimberly, I'm going to turn it over back to you. Thank you, everyone.
Thanks, Doug. So want to talk to you guys about quality improvement requirements. And so for most of you know that data tells the story. So just a couple highlights. Our outcomes are jointly agreed upon through the application for funding process by the ADAMHS board and the contracting agency. This is to be submitted no later than 1 month after the completion of the previous fiscal quarter. It must be submitted through the web-based MCADAMHS apps portal. This is the same location that you will be submitting your application for funding. Agency reviews include levy-funded services and on a biannual basis at minimum. We also have Basis 24 and Perception of Care, which are outpatient and inpatient tools. All providers will be required to submit a plan on current e-basis status and meet with the quality coordinator to ensure client compliance with these tools. Additional requirements. Agencies must begin to implement the following items. This is a guideline. Statements of DEI work in the application for funding with movement towards plan of implementation and programming. Movement towards incorporation of training across the continuum of prevention and treatment, as well as recovery support services, such as expert training, including ACEs screening, motivational interviewing, and mental health first aid training for all staff. All of this is being done in an effort to improve trauma-informed interventions and increase our trauma-informed response in our community. There are new recovery housing requirements if awarded. Beginning July 1st, 2023, all recovery housing providers seeking funding from OMAS or through local ADAMHS boards will need to demonstrate that they meet national quality standards for recovery housing through a nationally recognized body and participate in outcomes collection and reporting through the Ohio Recovery Housing Outcomes tool. This information will be posted on our website along with other documents mentioned today on the website after the presentation. Please also note ADAMHS will only reimburse for occupied beds. Calendar 2023 priorities, treatment and supportive services. The team has spent hours reviewing data and looking at taking in information from the community, what services are needed. We are looking at building out the continuum of youth services. jail assessments to the community, harm reduction strategies, crisis services and post-vention strategies, expansion of supports for underserved populations. All of these I will explain in greater detail in the slides that are coming up. Other than the above listed priorities, ADAMHS does not anticipate accepting any new or expansion request as established capacity meets the need of the community at this current time. We want to talk about jail assessments. And I want to clarify that what is being called a jail assessment is a service whose purpose is providing an assessment which aids in the connection back into the community with proper supports. We are looking for an assessment and a referral program to determine the need and referral to appropriate level of care for individuals in the community. The provider must adhere to the attached criteria. And when I say attached criteria, there is a request for proposal that you will be able to find on our website after the bidders conference. That building out a continuum of youth services, I'll give a big old smile for this, but this is exciting, but the target population for any expansion on this will be transitional age youth between the ages of 16 to 22 who are experiencing mental health challenges. This age group and this model of service is an identified gap in our continuum of care for youth services in Montgomery County. This programming should include small groups, individual sessions that are focused on socialization skills, independent living, stress management, budgeting, employment, all of those things, those activity of daily living skills that we need to ensure our transitional age youth are receiving. Priority will be given to a provider that is strongly positioned in the community to collaborate with local providers, hospitals, Montgomery County Juvenile Court, as well as a provider that will place a focus on training for youth peer support specialists. Also very exciting. Any and all youth wraparound services for calendar year 2023 will be capped at a budget of $250,000. This includes for staffing, travel, training, mileage, supplies, consultation, and any other indirect cost. So we had applied for a SAMHSA grant for calendar year, and we did not receive it. But guess what? Just because you don't get a grant doesn't mean you can't still do some of the stuff. So these are several of the examples of services we are looking to promote in calendar year 2023. Distribution of various harm reduction supplies, additional peer support, infectious disease testing, vaccinations, wraparound services, and telehub services. These are just several examples. Tristan, want to take this one?
Absolutely. Thanks, Kimberly. If you don't know me, my name is Tristan Ball. I'm the Director of Prevention and Early Intervention Services here at the Montgomery County ADAMHS Board. So I'm going to go over kind of a joint collaboration that we have between our teams in terms of treatment, supportive services, and some early intervention services. And that's really post-vention. So if you're familiar with like loss teams, or any kind of post-vention service that happens after an individual either attempts suicide or we see a fatality from suicide. So post-vention refers to activities which reduce risk and promote healing after a suicide death. So as I said, this can really go one of two ways. So this can include programming to support and stabilize loss survivors, so individuals that have lost a loved one to suicide, or can be programming really geared towards individuals that have attempted suicide and really promoting their journey of health from that point. So post-vention can also include training for first responders, coroners, funeral directors. You see the list there. Really anybody that has any kind of helping profession that is touched by this issue is really what we're looking for. We want to expand these services as far reaching as possible. I have here staff will be trained in assist if you're familiar with the assist training. But really, this is the first time we're going to be doing this. We're looking for some creativity. We're going to be working really closely with the partners that are identified in this to really get this going and set up a framework in Montgomery County, because we want to do this and do this well. So with that said, I will turn it back to you, Kimberly.
Thanks, Tristan. Appreciate it. So I had mentioned in one of the previous slides about expansion of supports for underserved populations. So it would be a good idea now for me to be able to expand on what underserved populations we are talking about. So one of the things we want to look at is increasing the number of guardianships that are accepted for referral based upon the criteria set forth by probate court. We want to decrease the number of referrals rejected based upon the prospective ward not wanting to have a guardian. We also want to look at increasing social connectedness and focusing on our aging population. So social connectedness, this is essential for assisting with physical, cognitive functioning. And we also want to look at food equity and access to resource for individuals with limited access to food, to nutritious options. We're also looking at intergenerational connectedness through education, awareness, building in schools and communities that cater to the needs of the aging population. So I do want to share, as you see from when Tristan was speaking and then now when I'm talking, there's definitely a working together between prevention and treatment, where you see there is a little bit of an overlap where we're looking at some of the educational work that needs to go into schools and communities to be able to support this. The other underserved population that we are looking at are our veterans, military members, and their families. And I want to encourage everybody, as we look at workforce being an issue, is that we need to increase our panels in order to be able to serve more people. So that would be a way to be able to support more of our veterans. We're also looking at STAR behavioral health cultural competency training. And as I said, begin to identify staff to increase payment options, such as TRICARE, military OneSource, other community care. And this is going to fall under that bucket of trying to help with some of our underserved populations. Dave, I'm going to hand it over to you, sir.
All right, thank you, Kimberly. Hello, everyone. My name's Dave Holbrook. I'm the Director of Administrative Services. So I get the pleasure of introducing the contract process with a fancy slide that's got some visual effects of sliding in of processes. So it's a pretty easy flow. As folks have mentioned, the application for funding will be available as soon as the presentation is over on our website. So you'll be able to use that. And then as you complete that, you'll send that in, then staff recommendations will staff will review, staff will make recommendations to program and service committees. And then it'll go for board approval. And then from there, it'll go for electronic signature. So that's the contract process. So talk a little bit about the requirements and guidelines. So there's four bullets there. And Doug had mentioned some of these things earlier, but want to cover again something he talked about, which is the liability coverage. Providers shall carry comprehensive general liability insurance in the amount of at least $1 million with an annual aggregate limit of at least $3 million. So just want to make sure that you take a look at those guidelines and those requirements. As we continue through these requirements, there's 5 other bullets that talk about professional liability, employer's liability, automobile liability insurance, as well as workers' compensation, and as well as directors and officers insurance. So the general information I want to share here, the important part of this contract information is, ADAMHS reserves the right to reject proposals and/or funds at less than the requested amount. Any entity that receives ADAMHS funding will enter into a contract with ADAMHS prior to any payment of allocated funds. All funding decisions are final and are contingent upon the receipt of allocations from the Ohio Department of Mental Health and Addiction Services. Thank you. I'll send it back to Kimberly.
Thanks, Dave. We're going to talk right now about the portal. So for those of you that already have login information to the provider portal, you do not need to request login information. If you are new to this process, as I stated earlier, please put your email address, your organization name, and your name in our chat. Our wonderful communication department will be managing that list, and we're very grateful for that. Thank you, Amber and Tina. So this slide is going to outline for you what happens after we give your information to Ascend. Ascend is going to create an organizational account in the provider portal. When Ascend receives the information based on the list that we give them, you will then be notified and you will go to the website, and that's where you're going to want to create a login. So there's a right below the login button, there's a link that says need a login. You're going to complete the form, making sure you select application for funding under the application you would like to request access to. When the form is completed, please be sure to hit register. What's going to happen then is I'll be notified of that. And then I'm going to go ahead, I'll go into the provider portal, and then I can give you access. You'll receive an email notification that voila, you're now able to get into the portal to start your application. One of the other things I really want to remind everybody is that when you go in to do your application, there is a section where you put your agency contact information. Please make sure that all of that information is accurate so that we can ensure we get it to the correct individual, whether that's corrections for budgeting or program, or if we just need to send it to somebody for a signature. Let's talk about deadlines. So today, August 26th, at the end of the bidders conference, we will take our list and we will send that to Ascend. You will be able to request a login after 6 p.m. tonight. Ideally, agency applications should be available on the 29th, but that is contingent upon the list that we send and ensuring that we have all the accurate information. September 23rd is the deadline for the application for funding submission. It is due by 4 p.m. Late applications will not be considered for funding. September through October, we are going to review applications. We'll send notifications. So if, for example, we see maybe a minor correction or something like that, we're going to let you know. We'll set up a time to maybe talk about it. So there'll be communication back and forth. I have a couple other reminders. There is a ton of information that goes into the PDF. So it's naturally going to take a few minutes to generate that PDF once you all click on the PDF button in the application for funding. If you choose to download the PDF, it's going to take a few minutes due to the amount of information included. So please don't close your browser while it's downloading. That's all that I ask. So reiterating once again, please ensure all agency contact information in your application is accurate to ensure we send contracts and corrections to the appropriate individual. I also want to remind you to please review all of the fiscal requirements and accreditation requirements, because we don't want to waste anybody's time. Though there are certain things that are required in order for you to even be able to apply for funding. So please review all of those. We will put all of this information on our website. And Tina, I'm going to pass it over to you.
Thank you, Miss Kimberly. I'm going to ask you to stop sharing for just one moment, because I'm going to share and walk through where everyone can find this information on the website. Does everybody see the website currently? This is where the wonderful Amber Mayhem that Kimberly mentioned earlier created. If you go to this treatment and support tab right here, you'll see where you can click the application for funding right here. It's currently empty because we're going to load all of these documents up as soon as this is over, but that's where you want to go. So treatment and support, application for funding, and all of the documents Kimberly and the rest of the team is referring to today will be available. Let's call it by 5 o'clock today. Should be earlier, but let's call it by 5 o'clock today. See this black box here at the bottom right-hand screen of the homepage that gave you the bidders conference information, this link? As soon as, you know, we're recording this, as soon as the recording renders, and you know that can take several hours for a recording this long. So I'm not going to commit to that by 5 o'clock today. But by early next week, we will have the YouTube recording on our YouTube channel, and I will put that link right here in this box. So you can just go to the homepage of our website, click on this, read more, and it will take you to the YouTube page, because a lot of people did mention to me that they wanted to watch the recording, but we're going to be unable to do so today. And then the only other thing that I would ask of you, because I will be working with Kimberly managing the FAQ process, we ask you, please do not ask questions of our staff members. If you have a question and you're thinking about something, somebody else probably is too, which is why we create that FAQ document. And every single question that comes in to Kathleen Hendrickson, Kimberly is now sharing her email address. All questions should be emailed to Kathleen. And then we're going to create a document that will be in that portal on the website. So where you're clicking to get all the other documents from today, we will create an FAQ document that will live there as well. And it will be updated weekly, if not more so, depending on the volume of questions that are coming in. So you can always check that FAQ document to see if your question is already there. If it's not, email it to Kathleen. We will add it to the document as quickly as possible and reload that document back to the website. We want to make this easy on you. That is the whole goal of the communications department, is to make accessing information and getting your questions answered as quickly as possible our goal throughout this process. So we appreciate you. We're glad to see you here today, and look forward to working with you on this.
So Tina, before you jump to questions from everyone else online, I just want to directly address a couple of those awkward areas. One of them being during our last cycle, we had some difficulties with our portal. And any of you who received prevention funding may remember that. We have really put some time into assuring that the portal operates smoothly for you this time. However, if you run into any glitches whatsoever, make sure you communicate that immediately. We certainly don't want to delay your ability to submit your proposals because of difficulties that may pop up with the portal as we're moving through this. So please let us know right away. I think we're in good place right now, but just in case, I wanted to make sure I brought that to you right away, especially for those of you who've not applied before. The other thing is we hear questions about why are you asking for this information in terms of eligibility. And I would ask you to keep in mind that we are funding with taxpayer dollars, and we have a responsibility and accountability, if you will, back to our taxpayers who support this process for us. So we want to make sure that when we are putting dollars into an organization, we're putting dollars into a place that's going to be able to deliver on those services that we have potentially purchased. When we make a contract, we execute a contract with you, then we've made a commitment for those funds, which then takes them out of circulation. And if things don't work out as negotiated in the contracting process, we are placed in a position of having to try to locate another provider quickly, or going without that service for a period of time, in a period when we've said this is a priority for the community. Now, there is a win for you all in all of this. When we're getting all of this information, one of the things we're working on, which will benefit you all, is the access to a portal where you're putting in information in order to be able to apply for funding, you answer a lot of those same questions for other funders. And our goal is for you to be able to get that information back out, which will allow you in some cases to do some cut and paste jobs in order to apply for other funding. So our goal ultimately is that it's a win-win for both of us. We get the information we need for funding decisions, but you'll also be able to use that information without having to recreate it every time when you're applying for other funders. So see it as one of those team builds and needs that we think is a great benefit for everybody. I just wanted to throw those two things out there. And certainly your questions are really important to us right now. So go right ahead.
Okay, we do have some questions in chat and I'm going to read them aloud, and whoever the appropriate team member is to answer that question will do so. And I also think this will be a great way to start our FAQ doc. I think we should take these questions you guys are bringing up for those who did not join us today. We'll use these questions in our FAQ. So first of all, what if we have COA accreditation, but are not currently OMAS certified?
So the requirements are listed that it's OMAS certification or any of the other accreditations that we have listed on the PowerPoint slide. So you would need to work towards OMAS certification or any of the other accreditations that are listed on the slide.
Are these applications only open to nonprofit organizations?
Dana, I can take that one.
Okay.
Thanks, Kimberly. We encourage for-profit as well as not-for-profit to apply. Just be aware, as Helen mentioned, we have accountability to the taxpayers. So we'll be asking some additional questions through that process. And again, it also depends upon the service you're providing. So I would say go ahead and apply. And then we will be, as Kimberly mentioned, we'll be reviewing applications and sending notifications September and October. Thank you.
Non-deemed status certification, question mark. Is that included? Question mark.
So the items that are included are the ones that are listed on the slide.
That is the last question in the chat box. Oh, what just popped up? Can you point us to a good place with clear information on OMAS certification instruction and process?
Yes, and one of the things that we can do is put the link for that information on the website following the bidders conference, if that will be helpful.
Any other questions? Feel free to unmute and shout it out. Oh, here comes one in. Is the mental health first aid training expected for everyone?
The mental health first aid training, obviously some organizations are larger than others, so it's not necessarily we expect everyone immediately to have mental health first aid training. So it's really more about working towards getting your staff trained in that. And I would say primarily looking at those staff that are not clinical in nature and starting with that.
Anything else?
When is the first training for the mental health first aid? And then is that also available via Zoom or Teams or virtual?
So the mental health first aid trainings, if you go to the ADAMHS website and go under training, you can look at our calendar and you will see that there are numerous trainings offered, youth mental health and the adult mental health first aid. And another thing that our wonderful trainers do is that if you have a group of people that you would like to get trained and there is a date and time that doesn't work for you guys, you can reach out to Brittany Long or to Becky Ketron, and they will look at our list of mental health first aid trainers in our community and reach out to them and try to organize a time and a date that works best for you and your and the people that you work with.
And I just put the link to the training calendar in the chat box.
Thanks, Tina.
I have a question. Good afternoon, everybody. I have a question relating to the required UEI, the Unique Entity Identifier number. So that number has turned out to be somewhat, there's a process to getting it, and sometimes that's time consuming. Even though we already had a DUNS number, the process of switching from the DUNS to the UEI, it's been 3 months and I still don't have my number yet. So is that something that once I can prove that I have actually started this process and can show the ticket, are we able to submit even though we have not actually gotten our number yet, if I don't get it by the 26th?
This is Doug, George. The ADAMHS board had to do the same thing. We had to go through the same process. And it does take about 8 weeks to get that completed. We do need that UEI number. As I indicated, we receive federal money. And part of the OMOS requirement for our risk assessment is to have that UEI number or SAM number. So I would encourage you to reach out to the help desk at sam.gov. And if you need that information, I can get it over to Kathleen and Kimberly. They have a help desk. I personally do that for the board. And I would put a rush on that. Tell them that you're trying to get it done as soon as possible. Thank you.
And let's add that to the FAQ, because that would be good information for everybody to have.
We'll do that. Thank you, Helen.
Anyone else? Feel free to throw it in the chat or unmute yourself. Great questions, everyone.
I noticed that Tim had a follow-up question to the mental health first aid training, and it said we wouldn't expect providers to participate then. Yes, we would want providers to participate. What I'm simply saying is that if you have an independently licensed counselor and then you have a team full of case managers, I would encourage you to get the case managers trained first, as they don't always have some of the clinical experience, and maybe they do. I mean, I did case management and I learned a heck of a lot being out there working with people. So this is more of us saying, hey, let's bring about more awareness about how to interact with people that are potentially exhibiting some signs of not doing well. And that even ties into how we're wanting to do more training around trauma. We want to be a trauma-informed community. So I know that it sounds like maybe you're wanting a very black or white answer, but really just looking at who has the least amount of experience around this, and then start with those people and getting them some of the training.
Okay, another question. If our agency has mental health first aid and assist trainers, and there are training needs, how would this be reimbursed or built into the application for funding?
I'm going to defer that question, Helen. I'm like, Helen?
Let us put that question and the response to that question into the FAQ, because I honestly do not have an answer to that at this time. And I don't want to tell you one thing right now and then come back around it another way. After I would even have a chance to kind of talk to the team about how would we address that. We always try to have some level of anticipation for your questions. That's not one that I don't think any of us really anticipated. And so let us make sure that we give you the correct answer to that question.
And another question, is there a link to update our DUNS number to a SAM number?
Doug, can you take that question?
Oh, my apologies. I was working on the FAQ. What was the question, please?
Doug, the question is there a link to update our DUNS number to a SAM number?
Thank you for repeating that for me. Basically, what SAM.gov is a registration for all entities. And you will go out there using your existing DUNS number. I assume you have an existing DUNS number. And you will go and update your information at SAM.gov, which I'm putting together for the FAQ. You'll have more information on it. But it's a really simple process. Sometimes if you don't use the exact same information that you did under your DUNS number, it will kick you back out and will ask for additional information. That actually happened to me because we have a suite 102 and I put the suite 102, I capitalized it, and I had to answer a couple additional questions. But as Helen indicated, I'm putting together an FAQ on this. This is new. It started this April. We did not require state fiscal year contracts because it was fairly new, and we ourselves were going through the process. OMOS and SAMHSA are also requiring these numbers. So as Helen mentioned earlier, what you do for us, you're doing for other grants. So this is a good place to start, and appreciate your patience with this, but this is a SAM.gov requirement. And in order to receive federal funds, because many of you do receive federal and state funds from OMOS and SAMHSA, and we have a duty as part of our risk assessment. We're required with taxpayer dollars to go through this process. We will actually verify your number to ensure that it's in good standing. And this, unfortunately, is one of those things that can delay your application or postpone it, or even worse. And we try to avoid that by giving you as much information as possible. So I'll get the FAQ to the team and get that out ASAP so you can get started on it. I hope that answers your question. Thank you.
So I'm going to jump in because Tawana, thank you so much, because you're seeking clarification, I think, on Chris's question and the way that we responded to it. And I took Chris's question to mean that they've got some staff who are already trained, and if they build that into their application for funding, and you correct me if I'm wrong, Chris, would we be reimbursing for their service in helping us to provide that service in the community? With respect to the general question about our trainings being free, generally, yes. Almost all of our trainings are free. However, there are some that we do have a small fee for that helps cover the costs of workbooks, and in some cases, meals. We spend a lot to try to assist with meals when we have day-long trainings. So there are times when there is a small fee attached to our trainings. In many of those cases, and again, there are very few times when we ask you to pay for it, then there's some times when we say to you, we will give you the money back, but our goal there is to ensure that someone who registers for classes that is costing us some dollars that we wouldn't anticipate shows up for the training. So that answer is not always just a real clean, yes, all of our trainings are free. Some of them have a fee attached to them that gets reimbursed, and some do not, but it's a rare occasion when there is a fee for an ADAMHS training. To help? Cool beans.
That does. And Chris did clarify in the chat box that you were considering his question in the appropriate way. So thank you.
Thanks, Chris.
Anything else? Anyone?
I do just want to verify, are these trainings required to be completed prior to the application submission, or is there just a promise to do them?
It's not required prior, and this is just a movement towards being trauma informed. Yeah, so just showing that movement towards that. But great question. Thanks, George.
I have a question. If an agency is in the process of being audited, but they do not have it done yet, does that have to be done by the submission of the application, or is there a time period that they'll have to get it in?
As we stated in our PowerPoint, that we need to have audited financial statements at the time of application. So if you make an application and those financial statements are not completed, then that does not meet our requirement. Now, if you have financial statements from the prior fiscal year, because we understand that it takes some time to get the past year completed. Like, for example, here in the county, our 2021 audit is underway. We should have it in October, but we have our 2020 financial audit. So we encourage you, and so I don't understand if you have that previous year or not, or if this is your first audit. If it's your first audit, then yes, we would need that audit. Does that answer your question?
I have a question. Kathy Campbell from St. Mary. I know this might be a silly question, but are you looking for new program? Are you can we use some of the existing program work that we are doing in this application, or are you looking for us to pilot a new program using this funding?
So thank you. That's a great question. So the information that we presented on today, that shows the things that we're wanting to work on and potentially expand or create or have those innovative ideas. Of course, if you already have programming that you have put in previous applications, this is not saying we fund nothing else and we're only doing the things that were on this PowerPoint. Does that answer your question? Okay, cool.
Okay, not to put anyone on the spot, but I'm going to. Michael Doble and James Dobbins. Amber has direct messaged you to get your email address, and it might have just gotten lost in the cascade of all the chat messages. Please respond to Amber's direct message with your email address so we can get you set up in the portal. And again, if you joined us late, we're only looking for the name, email address, and organization for those of you who have not received funding from us and are not currently set up in the portal. And we're going to take care of that for you immediately following this call. Yes, the PowerPoint presentation will be loaded up to that link on the website that I showed you following the presentation. The PowerPoint will be there, the application for funding will be there, the jail assessment paperwork will be there. And then based on all of your questions, which I love, of course, we'll create a document with links. We'll just create a document that says links. And so all of you can have the links to get the information you're requesting. And then, of course, we will begin the creation of the FAQ. That will probably not go up today because that's going to take us just a little bit of time to get all the answers to the wonderful questions you've asked us today. But look for that next week and look for the recording of this bidders conference on our YouTube channel next week as well. I think a question, does the audit have to be a full audit or a review from a CPA? Doug?
Thank you. We require an audit to be done in accordance to GAAP, generally accepted accounting principles. The auditor has to be independent of the organization and be a CPA that is doing it on behalf of an audit firm. Does that answer your question?
Please
Thank
feel
you.
free to jump in and ask the follow-up if it doesn't. And for those of you, no need to apologize if you send us your information, but you're already in the portal. We'll extrapolate that information. No problem. As I've mentioned to several of you in private chats, it's way better to have you twice than not at all, for sure.
Can I ask a question?
Yes, of course.
Hey, so I'm Caitlin from We Care Arts. We've gone through this process before, but we are currently in a transition. So our executive director that would have done this process before is no longer with us. So just kind of worried about being able to access our login information. So I guess worst case scenario, we can't. What would be the course of action for this?
So go ahead and send that email to Kathleen Hendrickson, and then she is our gatekeeper for all of these emails coming in, and she's going to funnel that where that needs to go. So, but honestly, we could take care of that real quick. That's an easy thing. So don't stress about that. Okay. Just email Kathleen.
I want to thank her for that question. To all of you who are submitting applications in our portal, please make sure that the name that we have as contact is the person with the authority to execute a contract. because we have delays in the process when we don't have the correct information in the portal with whom we should be communicating. Because I will promise you, when the authorized official adds their signature to the contract, on the last signature on it, I sign very quickly. Within the day, it's a completed document. But if we don't have correct information, it slows us down in getting what you need in order to really start delivering services. So thank you for asking that.
Helen, I'll just dovetail off that. Please check all of the contact information in the portal for agencies that are currently listed in there, because we ask Ascend to download all of the contact information, your CEO, CFO, the different people with the different titles in your organization, and we create our constant contact email list with that information. So the best way to make sure we're getting the proper information to the proper people in your organization is to update all the contact information in the portal. So thanks for reminding me, Helen, to shout that out too. I think we are caught up with questions in the chat. Anybody else have a question? We want you walking away from this today feeling very empowered, very encouraged, and having your questions asked to the best of our ability today, knowing what we couldn't answer today, we're going to get answers to you early next week. We appreciate you all so much. Helen, would you like to close us out?
I'll just close this out with a thank you. Never have we been more needed in this community. And I know y'all are feeling it. I know you are. And I just want you to know how much we appreciate you here at ADAMHS, and how much I personally appreciate everything you are doing. You don't get a lot of flowers that you get to smell at this point, right? Well, this is the day for flowers. I'm sorry we're virtual, but please consider yourselves receiving flowers for everything that you're doing on a daily basis. I was talking to someone a little earlier today and talked about the fact that this is hard work for the most part. Nobody's going to get rich off this work, but the richness comes from that sense of satisfaction for helping to lift another person up. And I know that's the motivation for this work. So please take our gratitude with you, and know that we're here not as gotchas. We're here as full partners, because without you, there's not anything that we could be doing in the community. So thanks you all so much. Have a wonderful weekend, and we'll be back at it on Monday, okay? Take good care.